All right, so your kid's waking up stuffy again. You got the drainage, you got the going on in their throat. Maybe they're running a low-grade fever, or you're hearing that dreaded creep cough. You know what I'm talking about, parents. So you're thinking, do I go to the pharmacy? Do I get my pediatrician on speed dial again? Or is there something naturally that I can take to help? So let's talk about what works and when to use it. Natural remedies, they aren't magic. But when used at the right time, they can support the bodies and often shorten the duration and shorten the intensity of sickness. Think of them as reinforcements, not replacements. For example, you wouldn't ignore a fever over 103, right? But if it's 100.5, you know what, you're playing, you're eating, you know, they're maybe a little lethargic, but, you know, they're still doing their thing. So you just want to help their body support and get through it. Now, a key reminder is always watch how your child is acting, not just the number on the thermometer when it comes to fevers. And there's a whole fever thing. We're not going to get into it right here. Part number two of this, sorry, that'd be 4. Part number 2 of this is top natural remedies and when to use them. Elderberry syrup is best at the first sign of a cold and flu. It helps block viral replication, which means growing, right? It's also our go-to at the first cough, or they start saying, oh, my throat feels weird. Number 2, vitamin D3 plus the K2. Now, it's an immune modulator, which means that it's great during winter when kids aren't getting enough outside because we get vitamin D from sunshine, right? Most kids I see are way underdosed. Check with your doctor or get a basic blood test if needed to make sure you have the right dose, because there is some risk involved with that one. Oh, I really love this one. Local raw honey. It soothes, it helps, it's great for allergies, because what are the bees doing? They're doing nothing but grabbing pollen to make honey out of it, right? So when you take it, it can help with your body's natural immune response to allergies. Now you can also do a nasal rinse. We do neti bottles here in the office and here at home too, to rinse all the sinuses out, especially with a light saline warm rinse. It's fantastic. Now you could also do Epsom salt baths, where you can get that magnesium just to flood into the tissues. It's great for stuffy heads. It's good for growing pains, or just an overall just a reset too. Now there are a lot of different essential oils that you can take as well too. Eucalyptus, tea tree. Tea tree is great for fungal infections and also great for bacteria and viruses as well. You can put them into a diffuser and just let it aerate and just cleanse yourself and cleanse the room too. One of the other big things that we use in the office and use at home is we have a nebulizer that we bought off Amazon, and we use colloidal silver in our nebulizer, and it really gets great right into the lungs, right into the sinuses. Fantastic. And also hydration with electrolytes. Yeah, I agree, you got to watch the sugar in some of the packets that they have nowadays, but the more electrolytes, the better your body's going to do, because you need to get that absorption, get those salts in your system to help replace it. Now, a pinch of sea salt, dash of maple syrup, a little bit of lemon. Man, shoot, that sounds good right now. Old school electrolyte drink. Now, these remedies, they can do wonders when at the right time and the right dose for the right reasons with the right patient. But if you're not seeing improvement after a couple days, or symptoms, they're escalating, like trouble breathing, higher fevers, lethargy, it's time for a medical checkup. We do too. We have a great pediatrician that we work with. Now, the point isn't to avoid medicine. It's to support the body first, and when it's time to tag in for more help. So yes, natural remedies can work, but they do work when they are put together with part of a plan, not panic. So in our next video, we'll be talking about how to tell when something is just allergies or when it's turned into an infection. But that's one of the most confusing things for parents, so I'm looking forward to going over it with you. All right, see you soon. Bye.